Hello, I'm Dr. Katie Friedman. I'm a board-certified pediatrician. I work in the emergency room setting, and I'm one of the National Advisory Board members to Responsibility.org. Sometimes with kids, it can be really hard to determine that they are struggling with their mental health. They're unable to communicate and sometimes don't even understand the feelings that they're having. So it's so important as parents, as providers and teachers, that we know the cues that something might be up or something might be changing within the mental health of your child. So the first thing to look out for is behavioral changes. When a child gets older and goes into adolescence, sometimes you're going to see those changes regardless, but it's extreme changes. For instance, they've completely lost any interest in the activities that were really excited for them. So whether it's sports or violin, they're kind of avoiding those or not wanting to join anymore. If they're having extreme changes amongst their friends, sometimes they will naturally just kind of change different groups. But if you're seeing that they're having lots of fights with friends or changing groups very quickly, it can be a sign that there's something going on. And then anytime your child is going into their room, they're withdrawing, they don't want to join activities, it can be a sign that there's a struggle going on. If your child is experiencing a mental health crisis, the first thing to do is to establish, are they a harm to themselves or to anybody else? If that is the case, you want to immediately go to the emergency room, as it's important to have them evaluated immediately. If your child is having feelings of sadness or stress, it's important to get them resources. So you want to go ahead and make an appointment with your pediatrician to get them as well supported as possible. It's so important that even at a young age, your child and you as a family are establishing and practicing good, healthy habits to cope with stress, because these skills that they have as a young age will carry on into adulthood, and what they've established at a young age will help them throughout their entire life. The best coping mechanism you can give your child is the gift of communication. You want to establish your child that they are always available to come to you for any problem that they might have, that you're never going to judge them, and you're always going to be a safe person for them to turn to with any obstacle they might have. Sometimes it's not only about giving them great coping mechanisms, but it's also about giving them positive feedback and reintroducing that coping mechanism that you see. So for instance, if your child's having a stressful situation and you're noticing that they cope with it in a positive and happy way, point that out to them. I saw last night that you were stressed out, and I really loved that you went outside and practiced soccer in order to help you overcome those feelings. As parents, we are our strongest role model to our child. What they see is what they do. So it's so important that you establish a healthy relationship with alcohol. So, for instance, if you're feeling stressed, we don't want to say to our child or out loud, I'm going to have a cocktail because I had a really bad day. It's important that even if we are enjoying a glass of wine, that we're using positive messaging around the enjoyment of a glass of wine. If we are feeling stressed, it's important to make a parallel of a healthy coping mechanism that we're utilizing in order to overcome that obstacle. So for instance, if we're feeling stressed, we go ahead and express that stress. I had a really tough day today. Do you want to go for a walk? I think that will make me feel better.